From June 2015 we rearrange our services within Northumbria. If you are ill and in need of emergency care, you come to the Northumbria Hospital at Cramlington.
It's really imperative and really important to us that patients know where to go so they're not confused about which service to access, so they can go to the right place to see the right person at the right time.
The most serious and sick patients will be seen at this site and receive state-of-the-art care from specialists 7 days a week.
There's so many benefits for patients, but the key, most important one is that they get to specialist care sooner and there's a lot more senior input.
For those really sick patients, it's really important that they do get to the right place, and by travelling those few extra miles they can ensure that they get seen by the right people, the experts, who can ultimately start their pathway of care much sooner than they can at the moment.
So from those first couple of hours onwards, there will be a senior involved in their care. That's very different to a lot of care in the UK.
This allows us to play to our strengths. It allows us to use the full expertise of all of the specialist teams we have, so that instead of physicians or surgeons acting generically, they will be working in their own speciality, so that the most seriously ill patients that we deal with can have the full expertise that we're able to offer.
We will still be providing a 24-hour walk-in service at Hexham, North Tyneside and at Wansbeck, continuing to see the patients we've always been seeing, but hopefully in a much more efficient manner.
A big part of our vision for developing high quality local services is around enhancing the services that we currently provide through our general hospitals.
It's been a great opportunity to be able to develop the diagnostics on the other hospital sites, particularly with the example of the new MRI scanner that we've invested at North Tyneside and the new CT scanner at Hexham. Again, another great opportunity to make sure that patients are getting the right scans at the right time in the right place.
We're taking the frantic hurly-burly of emergency care out of those hospitals. Means that they've got the ability to just breathe out a little bit.
We will have a walk-in service as well as an ambulatory care and an elderly care assessment unit. What that will allow us to do is to keep a vast majority of the current workload that we see.
So ambulatory care was set up because patients do not like being in hospital, and what we found was we needed to shape our services around the needs of the patient to improve patient experience and also free up unnecessary hospital admissions.
These centres house a dedicated team of a number of professionals who have skills and expertise in providing elderly care.
The hospitals will move to becoming mainly centres for elective care and local community services. Our community hospitals will go on exactly the same as they have before, being a focus for rehabilitation and returning people back to their local communities.
The work will be the same, but we will be offering a more streamlined service where minor injury patients who attend the department won't have to wait behind majors.
Point of care testing is a small laboratory within the department where we can test blood out of hours. So from 8 o'clock at night to 8 o'clock in the morning, the nursing staff have the ability to do investigations on bloods taken from patients, and we can get the results from those bloods back within 10-15 minutes of the patient arriving in the department.
There's been clinical involvement on every meeting, every panel, so it's been driven by teams that are going to be working in that hospital. So it's a hospital that we know we've designed and will work best for what we need for our patients.
I've been here so many years and I've seen so many different changes, but I think this is one of the major changes.
We go through change all the time in the NHS. Any industry or public organisation goes through change because we have to change to develop.
Big changes always come with their challenges, but I think the patients are at the focus.
I feel extremely proud to be part of the new changes. I think we are on the brink of delivering excellent emergency care.
It's great. It's one of the reasons I joined this trust. This trust is clearly a very forward-thinking trust.
It's actually a privilege to work for it, because you look at other organisations around the country that are really struggling, and I think I work for an organisation that has taken those challenges, accepted those challenges, done something about them and put in a provision in place which really meets the needs of patients. So I'm proud, but I also feel privileged to work for the organisation.
This new hospital is at the forefront of providing the best possible emergency care. So yes, I'm very proud to be part of it.
Yeah, I think the new model of care has to be the way forward for the whole of the country, to be honest with you.
I think we all should be proud to be working for Northumbria Healthcare. We've gone through a lot of changes in the years and the services have continued to be developed.
It's a privilege to be involved in something right from the word go and see it all come into fruition, and coming here today, it's just so exciting to be in this great building and can't wait to get in here really.
Just being in here, it just sets you going, doesn't it? You want to come and work here, and I wish we could come and do it next week.
What we set out as a dream is just about there and just about coming to fruition.